Now, while some argue that the damage to local businesses should outweigh the concerns about the virus, infectious disease experts say we can't just open up everything. Our ABC 10 News reporter Jeff Lasky looks at how the county is trying to balance controlling the virus with keeping our economy going.
We've heard the consistent message from our county leaders every week since March.
Facial coverings, social distancing, avoiding large crowds and gatherings, those are the strategies. They sound simple, but they actually work.
And yet after all this time, it feels like we're still right where we started, with infections going up.
I think the technical term for being half on, half off lockdown for 8 months is this sucks. It sucks. Nobody wants to be doing this.
Dr. Rebecca Fielding Miller is an expert of infectious diseases at UC San Diego. She says it's not a mystery why cases are spiking again. The more people gather, the more the virus spreads.
The reality of it is indoor spaces with people talking without masks on are not safe. So I think that's really important to getting this under control.
She says stricter regulations are an important way to slow the spread of the virus, which San Diego did following spikes in April and July. But she says the herd immunity idea, that we should just open up and let the virus run its course, doesn't make sense. She says millions could die in America, and there's no guarantee the virus would go away, because we don't know how long immunity lasts.
It has really negative long-term effects. And so we would end up with extraordinarily high rates of disability and mortality, potentially for no gain at all, for people to just be able to get reinfected in 6 months. And so I understand the attraction, but it's also not viable.
Dr. Fielding Miller says the county and state have been taking half measures, trying to avoid a full lockdown and letting many businesses stay open. But that will only work if everyone is committed to be safe. Those same things we hear all the time.
We have to do what we know works to help decrease the spread of COVID-19.
Jeff Lasky, ABC 10 News.